Good evening, all of y'all. Today's video features the very talented Dr. Bharathi, who has secured 15th rank in FET exam, and she has taken FNB seat at the Maulana Azad Medical College, New Delhi. Many congratulations on this wonderful score in FET, Dr. Bharathi, and many congratulations on being allotted an important seat in a prestigious institute at New Delhi. So over to you, Dr. Bharti. Let's hear about you first and then tell us about your strategy to prepare for FET. So Dr. Bharti.
Ma'am. Hi, ma'am. Thank you, ma'am. I'm basically from Tamil Nadu, ma'am. I did my undergraduation from Punjab College, Tamil Nadu, and MS from Maulana Azad Medical College, New Delhi, ma'am. And I took FNB seat in the same college itself.
Okay, that's nice. So tell me, when did you pass your post-graduation and when did you decide that you will prepare for FET?
Ma'am, I passed my post-graduation in 2021 only. In the same year only, I gave FET exam.
So you're a fresher?
Yes, ma'am.
This is your first attempt?
Yes, ma'am.
Wonderful, wonderful, Dr. Bharti. Congratulations on being able to do that also.
I planned on doing this exam in third year post-graduation itself, ma'am. While I was preparing for my university exam, I'm concentrating in MCQ pattern also. Like I wanted to give NEET SS also and FET exam also. So general OBG part, I was thorough anyway for the PG exit exam. And only the specialities I need to read more for this exam.
So when you started during your PG times, you decided when you started preparing for FET, what all did you refer to in that time before the exit exam? What was your source that time?
Okay, source. I did not have any source properly, ma'am. Actually, I used to search in Google only FET exam tube banks and all. I never got any proper question banks also and any proper study material also. Then I came to know this Sakshi Arora book is for OBG. Anyway, we use that for general obs gynae. So I started doing that also during my preparation. Then during the last, like near the PG exit exam, I came to know about your course, ma'am. So I started using your course after that.
So before your PG exam?
Theory books only. I did not have any proper material for that.
So you came to know about reproductive learning before the theory exam or after it?
Just before the theory exam.
Before the exam. Yeah. Right. So after that, how many months were there? When was your exit exam?
It was like 1 month, within 1 month of my exit exam only. Then after that, I had 4 months before the FET exam and NEET SS exam, ma'am.
So 4 months of preparation you did?
Yes, ma'am. I worked as SR also in MAMC itself actually that time. And I took a break of 1 month for a full preparation.
For preparation, final preparation. Wonderful.
Yes.
So let us individually hear from you. What were the sources of reading obs gynae, reproductive medicine, and then where you read oncology from?
Yes, ma'am. For obs gynae, for obstetrics, I read important chapters from Williams in the post-graduation itself, like labor chapter and obstetric complications chapter. And gynae part, I read it from Novak's. And gynec onco, I used to read Barack and Hacker. I thought, I knew that Barack and Hacker is for this FET and NEET SS exam. So during my theory preparation itself, I used to refer some cancers from that book only, ma'am. Then Spiroff, I did not have time to read. I read only infertility chapters from Spiroff. And for IVF, I did not have any proper books also, ma'am. I just watched your videos. That was more than enough for the exam.
That's nice. Regarding Spiroff, students keep asking me, is it very important to read Spiroff because it is not everyone's cup of tea?
Yes, ma'am. It is a very big book, and if you have time, like if you are preparing in third year post-graduation itself, then you may be able to read it. But otherwise, if you are working and preparing, it is not needed, ma'am. Your course itself is more than adequate, and you just need to go through guidelines also, ma'am. Most of the questions are from guidelines. I don't think theory book is more important for these exams. Only guidelines are important, ma'am.
That is a very good advice that Dr. Bharti is giving. It's not very important. Most of the toppers have read Spiroff and Barack and Hacker, and you do believe that it's not very important to
I have no questions from Barack and Hacker, ma'am. I regretted reading that book. Most of the time I use that book, but I felt very bad after
This
exam.
is a topper who is telling you that she regrets having read Berek and Hacker in and out.
Yes,
So
yes.
from all the
the
interviews,
there from FIGO updates only, ma'am. I read 2022 FIGO update
so
also.
you were the one who had messaged me panicking that
Yes,
should I read FIGO updates,
yes,
and I wanted to be on the safer side, and I said yes, you should read.
Things came from that update, ma'am.
Okay, so my advice was good. I couldn't have said that you shouldn't
And
read.
even the anatomy questions, like gynec anatomy questions and all, also they took it from FIGO update. Like surgical anatomy, FIGO had some specific material for that. It is like 4-5 pages ka PDF. And this oncology part also, and AUB part also, most of the part I felt they take it from this guidelines, updates and all, ma'am.
The good thing about FIGO guidelines is that they are concise. They are made for the general practitioner. Berek and Hacker is for a super specialist.
Yes,
Well, FIGO guidelines are for any OBGY practitioner. They are small, concise, simple language. So FIGO updates is the least that you can do and you should do at least for. And
Yes,
Dr. Bharathi is telling that all the questions were from FIGO guidelines only. So that's a relief for all the students who have just got 2 months now to prepare. Go through all the FIGO updates. A lot of questions.
Also, they had too many questions, like endometriosis questions were more. They were from yesterday guidelines and
only.
FIGO guidelines. So,
and if you read Spiroff for endometriosis, Spiroff is not worthwhile for endometriosis. It's a big chapter.
Questions were like practical kind of questions.
Yes, which is not mentioned in textbooks. Right. So it's optional. If you are interested in reading big books, you still have 1 year before your exam. You can read those big books. But if you're sincerely, seriously preparing for the exam, again, I'm telling it's the time to close your textbooks and make your preparation more focused. So exactly tell me, OBGY, what did you read? So we know that Spiroff, Berek and Hacker are not as important. For OBGY, what did you read? What is important?
Also, I felt guidelines are more important because the basic OBG part, like theory part, we always know. Anyway, we read that for the 3 years, ma'am. So we don't need to read the theory part of OBG. We just need to know the updates like ACOG guidelines and RCOG guidelines. This hyperemesis, they had 3 or 4 questions, all were from RCOG guidelines. So I felt OBG part also guidelines are, it is not like a neat PG pattern. It is like you need to know about the updates and guidelines.
Yes. So OBG, obstetrics, you have to know all the guidelines. And students keep asking me if there is a contradictory question, which one to rely, RCOG or ACOG. You have to, know both the guidelines, and then you have to decide in the exam where the question has been picked from.
Mostly, they will choose from single guideline only. So
they will choose from single guideline.
It is not.
They will not verify that the other guideline is saying just the opposite, and it will confuse the students. They'll never verify that. You have to pick. You have to read the examiner's mind. You have to know where the question is from. It is going to be at least at that much of unfairness you have to expect in the exam. Nobody is going to read 2 guidelines to give you one small question, right? So OBG, you're saying it is guidelines. All the guidelines have to be read completely. For gynac, tell me general gynecology.
Ma'am, general gynecology, I read Novak's book, ma'am, important chapters, Novak's gynecology book. And UR material was good, ma'am. PCOS, endometriosis, and menopause chapter and all were from UR notes only, ma'am.
Okay. So gynae, the notes should be sufficient.
Yes, ma'am.
And reproductive medicine and obs gynae and gynecologic oncology.
Gynec onco, I read Berek and Hacker and FIGO updates, ma'am. NCCN, I read some part, but I did not have much time to cover the full of the NCCN guidelines. Only if I had any controversial doubt, then I read NCCN. Otherwise, FIGO only I followed, ma'am. Right. And if I used only your videos and your notes, ma'am, I did not read any other sources.
The reproductive medicine part is quite complete. You can refer from the class notes and class videos only. For oncology, NCCN is something that you can refer to whenever there is a doubt. That is what you're telling me. That's correct, because NCCN is so vast. There are so many tables. It's difficult to remember all the tables. You will get confused. You cannot base your entire revision, entire reading on NCCN. You have to read a textbook form, which I would suggest FIGO updates is quite complete. And it's concise and it's very simple to remember. If you have read Berek and Hacker, FIGO updates is like you can finish it very fast. So that helped. You had read Berek and Hacker, so Figo updates was very easy for you.
Yes, ma'am.
And you got questions from Figo updates. Wonderful. So last month preparation, let us discuss about that. How did you prepare in the last 1 month?
Ma'am, last month I spent the last 2 weeks just before exam only for gyneconco and the IVF, ma'am. I did not read much of the general OBG part because I felt specialties is more important. And IVF full week I spent your videos and your PDF I used to revise. And for onco part also I spent another week, ma'am. So last 1 week, 2 weeks at least for specialties we need to give. Before that we can revise general OBG for part for.
Wonderful. So let's talk about the exam now. In the exam, how many questions you attempted? Both the exams were negative marking exams. So how did you decide which all to leave, which all to attempt?
Ma'am, I felt if you are attending less than 95, then you are out of the game, ma'am. Like it is only 100 questions, so you can't risk also. So I attended 98 or 99 in FET, ma'am. I left one or two. One
or two you left.
Mm-hmm.
So this is what all the toppers have been telling, that you have to attempt 94 to 98 questions. And how did you decide which all to leave? How did you decide these are the 2 questions that
like
I'm
very
doing?
new, very new question, like I did not know the answer at all type of question only I left, ma'am. If I know at least, if I can rule out one answer, then I attended.
Okay, so this is kind of a rule that all the students are following, and this is not going to be very harmful since everybody is doing this, that you know anything about the question, you mark it. If you don't know anything, you have never heard any word in the question, then you don't mark it. Other rule which students say is if you can rule out 2 questions, 2 options, you will mark the question.
Yes, ma'am.
Right. So it was nice talking with you, Dr. Bharathi. It was nice knowing you. You were one of the people that I have known. In fact, all the toppers, I am proud of the fact that I have known all the toppers personally. And you were the people that I have definitely known personally for a long time. I know I took a little long time to reply to those messages, but still.
But still you helped a lot, ma'am. Like
I did want to help everyone in every little possible way that I could.
Yes, ma'am. Thanks a lot, ma'am. And you always to reply whatever the question I asked in group. Like if I have any doubt, you were always there.
Yes, I did try my best to reply to the students. One small tip that you would want to give to the next batch who has their exam in maybe the next 2 months?
Don't read textbook a lot. Just read the guidelines mainly, ma'am. That is the main thing.
Wonderful. And how helpful was ReproNeat videos and notes for the preparation?
Ma'am, I felt it was very useful, and I came to know about the, it was my first attempt, so I did not have any idea regarding what kind of question they will ask. So I searched a lot. I did not get any Q banks also. So then I followed your videos, and you used to give link for this guidelines also, yesterday guidelines, this Figo and all. So then I followed reading that yesterday guidelines from your videos only, ma'am. And for IVF, your notes and PDFs are more than adequate. After listening to your videos, I just used your PDF for reading that, ma'am. And onco, I told Figo update is more than enough.
Figo update is more than sufficient. So that's wonderful. This advice that you have given is something that all the students, you know, will find very comforting, that textbooks are not very important. Figo updates is more important than NCCN. And you, the best part of the interview was that you regret having read Berek and Hacker. That is going to be such a good news for many students. Yes, so it was nice talking with you, Dr. Bharathi. We will stay in touch. We're in the same field. That's all the time that I need from you, Dr. Bharathi.